Hi everyone, I am Dr. Vibhor Borkar and welcome to my channel. I am a practicing pediatric gastroenterologist, hepatologist and liver transplant physician practicing in Mumbai area. Have you ever worried that your kid is spitting up or complains about pain in the chest? He might be suffering from something called as gastroesophageal reflux disease. I am sure you have heard of this term. Let's visit this in a simplified way. What is gastroesophageal reflux disease or GERD? Let's see. When our stomach content, they rise up and come into the esophagus or the food pipe, we call it as a gastroesophageal reflux. Why does this happen? That normally there is a wall which is situated between the food pipe and stomach, and this wall generally protects from the stomach content to go up in the esophagus. We know that stomach has an acid, and if the contents come up in the food pipe, it is going to cause burning sensation in the food pipe. That's why nature has created this mechanism. Now by any means, suppose this function goes down, so what's happened? The contents goes up, the person may get the symptoms, and then we call it as a gastroesophageal reflux disease. Now let's see the different clinical symptoms. Reflux disease or GER and GERD means gastroesophageal reflux and gastroesophageal reflux disease. These two terms are different. GER, it's a normal phenomenon. However, when it creates a symptom, we call this as a gastroesophageal reflux disease. Now if you see the babies, the wall which separate the food pipe and the stomach, it is not mature. So it's very common that after the feeding, the contents rise up in the esophagus, and sometimes to rise to the extent that the child spits out the content. This is very common. It generally starts from 6 weeks to 2 months onwards. It rises by 5 to 6 months to its maximum intensity and then slowly settles down. Now, if as a parent, if you are watching this, it's very frightening and you will be very uncomfortable to watch this. So how to know whether it is really a normal thing or it is a disease? So what you have to see after the spitting, how is the baby? Is the baby playful, cheerful, continuing his normal activity? Along with that, child is gaining weight, there is no excessive crying, then probably it is a normal phenomenon, what we call as a gastroesophageal reflux. We call these babies as a happy spitters, and it really doesn't need any treatment. Now, when should we worried about it? Now, if your child is spitting like this and is excessively irritable, is arching the back, or there is a small amount of blood or the traces of the blood, child is not gaining weight, excessively crying, probably the child has a symptom because of this reflux disease, and these kind of patients need attention and the treatment. Now when the reflux disease occurs in an older kid, there the child can tell about the symptoms, so there is good correlation between the disease intensity and whatever the symptoms are. So here we can diagnose it clinically, and the symptoms are generally after the major meals, the child feels pain behind the chest or upper part of the tummy. Sometimes there is a sour taste in the mouth, and most of the symptoms aggravate after eating or lying down. If it aggravates further, there can be vomiting and there can be sometimes the blood in the vomit. So these are the symptoms of the reflux disease that happens in an older kid. Now how to diagnose? In older kids, it can be diagnosed by a good clinical history and examination. And in the babies, I have just explained in detail. When they are worrisome, suppose it is difficult to differentiate, then there are certain tests are available when it is difficult to diagnose clinically. The tests are doing a upper GI endoscopy. So in upper GI endoscopy, we see the damage that occurs to the esophagus. We see whether the wall is at the right place or not. And sometimes even the biopsies is taken to see some other diseases there or not. Other methodologies are like doing a 24 hours pH and impedance metry that is available with us. Also, sometimes the esophageal manometry to see the pressures inside the esophagus can be done. So these are the advanced investigations which is possible to do. Sometimes the children with obesity, when their weight is very high, again they can get the reflux disease. And also, if suppose you are feeding a child a lot or there is overfeeding, these kids also get the reflux disease. Certain foods like spicy food, lot of oil, sometimes the fizzy drinks, a lot of caffeine and the food containing chocolate, they can increase the reflux disease. Let's see how to manage the reflux disease. Most of the reflux disease can be managed by the lifestyle changes. So the simple steps like eating in a small portions, like not allowing the child to lie down immediately after the food intake, avoiding take the medications or the food which aggravates the reflux disease. These are the simple means to tackle reflux disease. Sometimes medications which inhibit or decrease the acidity, they do help in the recovery. A group of patients who do not respond to the medication, they may need advanced investigation or sometimes the surgical intervention. So in short, reflux disease can be managed with simple dietary changes, changes in a lifestyle, and sometimes medication. If the child still continues to have significant symptoms, do not hesitate to reach a pediatric gastroenterologist near you. If you like the content of this video, please subscribe, like and share my video for the patients or the people who might benefit from this video.